procedure, there are risks, and it's important that you understand these risks before going forward. A risk of Botox that is the most common risk that we talk about is something called upper eyelid ptosis. Now, Botox works to decrease muscle activity, and it's injected into certain muscles. And say if you inject in areas that pull your brows down, then and you weaken those muscles, the other muscles can help to lift your brow and help to rejuvenate your eyes. Now, if some of that Botox trickles down into your upper eyelid, something called upper lid ptosis, which is droop of that upper lid, can occur. So when you open your eyes, one side doesn't open as much as the other. There are some eye drops that help combat this until it wears off, but it's something that really is going to probably bother you for a couple of weeks to maybe even up to a couple of months before that Botox wears off. There also, with every injectable, it's being injected with a needle or a cannula, and we're breaking the skin. When you break the skin, you could always introduce some bacteria, but infection is quite rare with these products. What is more common is bruising. I got a bruise last night. I injected myself, so I will take full credit for it. But anytime you break the skin, it's a huge network of tiny little vessels underneath there. You can decrease your risk by going off blood thinner medication a week before the procedure, which includes things like fish oils, vitamin E, ibuprofen, and aspirin. Aspirin actually works a little bit longer, so if you're taking a regular dose of aspirin, you need to be off that for 2 weeks. Now, when you inject fillers under the skin, dermal fillers, and there's a huge number of fillers available now, there is a risk that it may be palpable, it may be a little bit asymmetric, and it may not fix the problem completely that you're looking to correct. It is not reasonable to get rid of all of the lines on your face. Our goal is to create more light highlights and to help decrease furrows. But it's not reasonable to expect that all of the natural lines like nasolabial creases and marionette lines may go away just because you're putting a dermal filler in there. Now, around the eye, especially in this area right here, that skin is very thin. And these fillers in general, most of these are clear, and light can reflect through it and give the top of the skin a little bit more of a purplish or gray discoloration called a Tyndall effect. That's actually what I was treating on myself yesterday, putting a little bit of something called hyaluronidase, which helps to break down and get rid of the filler almost overnight, where you can, if an area was a little overcorrected or you do see a Tyndall effect, we can treat it by melting the product that's there. Most of the other complications are due to expectations from patients. Now, a teaspoon of volume added to your face doesn't seem like it would go very far, but that is five syringes of general filler, and so some people's expectations are that they may just need 1 or 2 syringes when really they might need more. Also, fillers are going to last a little bit differently depending on the product. Some are intended to last 6 months to about 12 months, others may last up to 2 years. The biggest reason why people think they go away too quickly is that really there was not a very aggressive correction. So if you think of a hole in your yard, if you only partially fill that hole and you look out in your yard, there's still a hole in your yard. If you fill it flat, or even create a little bit of a mound, obviously if you think of a little sieve on the bottom where that dirt is leaving that hole, the more you fill it up, the longer it's going to last. So let's talk about the real scary complications that can happen with filler. One is that you can get a delayed hypersensitivity reaction. So filler is injected, and at some point down the line, you may wake up with the area tender and swollen. This is similar to a type of allergic reaction, and most of these can be treated with just over-the-counter medications like Benadryl and antihistamines. If that doesn't resolve it within about 48 hours, you can also do a course of steroids. That doesn't mean you can't get filler again in the future, but this is something that we have seen. It actually happened to me, and it was easily treated within 48 hours. Now, the real scary complication is if some product gets into a blood vessel and can cause a vascular occlusion. What that means is a little bit of, like a little drop of filler travels in the bloodstream and eventually gets lodged, and whatever that vessel was feeding downstream can be starved of a blood supply. Now, that can happen anywhere on the face, but the scariest areas are up around the eyes and in the forehead area, and also in the nose. There have been reports of blindness, and this has been published. If the blockage occurs on the retina, that can be an instantaneous and generally irreversible problem. If it is affecting an area of skin, we can flood the area with hyaluronidase, which is what I used to break up my filler here yesterday. And there are some other things that we can do immediately to help increase the blood supply to that area, and those treatments have been very, very successful. So I've used this video to try to highlight the most common complications or the most serious complications that somebody needs to think about, but our full consent forms are available on the website and when you come into the office. And I think it's smart for anyone, if they're having a procedure done, to go ahead and read these thoroughly and make sure you're prepared with questions. So those patients who are interested in getting fillers just need to be advised that there's always a risk, regardless of how good somebody's technique is and how safely things are performed. There's still a possibility, albeit rare, a possibility that some of the bad complications can happen. And I think everybody should expect if a needle is going to be placed in their face, they might get some bruising. So I guess the best analogy I can use is, regardless of how good of a driver you are, regardless of how safe your car is, if you're out driving in traffic, there's always a chance you might get in an accident.